Good afternoon and welcome to Webinar Wednesday. We're excited to have over 200 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday prize pack for answering this trivia question. Today's sponsor, RTI, is headquartered in Sweden with its U.S. office based in New Jersey. Pulp Fiction, Saturday Night Fever, and Grease starred this famous actor born in New Jersey. What is his name? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to join us for the 5th Annual Imaging Conference and Expo, which will be held February 16th through the 18th at the M Resort in Las Vegas. Take note that we have moved the dates from July to February of 2018. The ICE conference will bring imaging service professionals from across the nation to Las Vegas for 2 days of learning, networking, and the latest advances in imaging. Registration is now open. Details can be found at attendice.com. All right, and the winner of our Webinar Wednesday prize pack is George Scarlitas. Congratulations, George. The correct answer is John Travolta. Webinar Wednesday would like to thank our sponsor, RTI. RTI provides complete quality assurance solutions for all X-ray models and facilitates with click-and-go solutions for your X-ray QA. For more information, visit www.rtigroup.com. Our presenter today is Rob Morrison, Senior Applications and Product Specialist at RTI, who has over 30 years experience working with and for RTI in development, sales, and support of non-invasive test tools for non-invasive QA measurements of diagnostic imaging X-ray generator parameters. Rob, you may begin whenever you are ready.
Thanks, Kristen. As you can see, today's title is Practical Dental X-ray QA Tips and Solutions from RTI. So without any further ado, let me start here. And the first slide I've got coming up here is actually a very modern dental facility, a very new one. This is in Pendleton, Indiana. And as you can see down in the bottom right-hand corner, it's got a nice warm and friendly waiting room. The dentist that runs this operation was very kind in letting us come in and do some measurements and take some pictures. So some of the pictures you're going to see throughout this presentation will be from her facility. All right. What types of dental X-ray devices are out there? The first one is intraoral. Basically, there's about a little over 234,000 intraoral dental units in the US. That means there's about 1,300 people per intraoral dental, if you want to look at it that way. And how does it work? The imaging medium is put inside the mouth. I'm going to guess that most everyone who's probably attending this webinar has had an intraoral X-ray before where they've had to clamp down on either a film or some digital medium in their mouth. And that's the intraoral dental unit. Then you've got the extraoral units. That means the imaging medium is outside of the mouth. And the units there are the panoramic, the cephalometric, the dental cone beam CT, which is kind of new on the scene, and then a actual dental CT unit. Panoramics and cephs are the challenges to measure on above all of these. If you want to learn a little bit more about these different dental types, you can go to this link, Cleveland Clinic, and this Types of Dental X-rays. It was published in June 2017. It's very good. Okay, here's some intraoral dental units. As you can see here, there's on the upper right-hand corner, there's actually a portable unit. This is the Nomad, manufactured by Rebix. It's been out for quite a few years, and it's very popular. And it's makes it nice. You can just run from room to room. But more prevalent, of course, are still the intraorals that are wall-mounted. You've got a picture there on the left upper corner. That's a Progeny. That's a new unit. That's a high-frequency based. Down below that, you've got the old standard, and there's a lot of these still out there, Gendex 770s. That's a single-phase half-rectified unit. And then on the right, there's another intraoral unit there as well. When we look at the extraorals, you've got the panoramics and the cone beams, the CTs, and the cephs. Up on the left-hand corner, you've got a panoramic unit there with also the ability to do a ceph image. And then off to the far right is a standard panoramic unit, one that we actually measured on. Down in the center, you've got the cone beam unit, and off to the bottom left is a true dental CT unit. I've never measured on one of those myself, and I've never seen one. They're typically found in hospitals, I believe. Okay, dental radiation exposure. In all of our measurements and preparing for this webinar, we actually had a question from one of the dentists who said, how much radiation do you really get when you have an intraoral x-ray? And here's some interesting facts. Dental x-ray radiation exposures is small compared to all other sources of radiation. And if you look up the NCRP, they'll tell you that an effective radiation dose from all sources, that means both man-made as well as from our environment, is about 6.2 millisieverts per year. And if you take and live in Denver, or let's say New Mexico, up on one of the high plains, you can add another 1.5 millisieverts onto that because the atmosphere and being closer to the stratosphere, so to speak. So half of that 3.2, or I should say 6.2 millisieverts, comes from natural sources, from the soil, radon gas. In fact, it's estimated that 2 millisieverts, we all receive about 2 millisieverts a year from radon gas. And then you've got the cosmic aspect of it. If you fly like I do on a regular basis, you're getting dose there while you fly. You'll see a little bit more on that in a moment. The other half comes from medical x-ray imaging and radiotherapy, man-made sources. Here's another interesting fact. About half, that is probably about 1.5 millisieverts, comes from CT scanning. And CT is pretty prevalent in our world today. So when we look at dental radiographs, they're only about 2.5% of the effective dose that we receive from X-ray imaging. If we move on from this, and by the way, there's some links. You can look those up. All this information is there and more too. How does it compare? Well, if we take the top one, intraoral X-ray, you can see from typical intraoral X-ray exposure, you get about 5 microsieverts, okay? If you compare that to the natural radiation you'd get from your environment, it's a little bit less than a day's worth of radiation. If you get a panoramic unit or a panoramic X-ray done, it's about double that. And now take a look at this. If you take a flight from, let's say, LA to New York City, you get about 30 microsieverts. So about 6 times the amount that you get from an intraoral dental. And that's equivalent to about 4 days of background radiation. If you're like me, who flies probably on the average around 60 to 70,000 miles a year, I'm getting equivalent of close to 2 mammography exposures, so around 800 microsieverts. And then if you look down at the bottom of the list, if you were going to go get a CT for your heart, coronary computed tomography angiography, that's about 12,000 microsieverts, which is equivalent to about 4 years of natural radiation. So that hopefully gives you a little bit of a balance so you can see how much radiation you really do receive from dental x-rays. Okay, who should perform dental QA, or why should we perform dental QA, I should say. The FDA requires dental x-ray devices to be surveyed every 4 years. And that happens when they get installed or on a 4-year basis, or if there are any changes that take replaced. For instance, let's say you had to change out a tube. And the people that do those surveys are the state agencies. And if I take and look at the state agencies, they all look at doing surveys anywhere from every 2 to 4 years. In addition to the state agencies doing these surveys, there's X-ray service engineers who typically have to do PMs according to the manufacturer's recommendation. That could be anywhere from 1 year to 2 years, or maybe less than that. Now, what I did was I took some time to look at one of the states, because I know the state of Maryland has quite a program for dental QA. They take and survey the facilities every 3 years, okay, so less than the 4 years, but more often. The radiation machine part of their inspection includes looking at the minimum patient exposure, looking at the operator protection, looking at the protective apparel available, lead aprons and so forth. They look at the timer accuracy and reproducibility on the units. They look at the exposure reproducibility. They look at the half value layer. They look at the field size. And then they look to see the latest preventive maintenance service report that's in the facility. Again, there's a link there if you want to take and check out further on Maryland. In addition, they require that all the facilities have preventive maintenance performed on the dental unit that's according to the recommendation by the manufacturer. And if there is no recommendation, they tell you to do it every year. So basically what this all means is that a service engineer goes out, he has to do the PM, and after he does that PM and creates a report, that gets submitted to the state within 30 days. So the state always sees these PMs coming in, and then they do their surveys every 3 years. So you can see it's quite a rigorous program that the state of Maryland has. And I believe they're the only one that has that rigorous of a program. In addition, the AAPM, the American Association of Physicists in Medicine, has a task group 175 document titled Acceptance Testing and Quality Control of Dental Imaging Equipment. There's a link down there if you'd like to pull it. It's an excellent document. And this gives you an overview of how they expect that dental surveys should be done. And you can run down through here and see the annuals under the frequency. And there you've got beam quality on all units, KVP accuracy on all units, timer accuracy, that's only on the intraoral and the cephs, then exposure reproducibility on all units, technique factors. So it's an excellent document if you want to have some sort of quality control on how you should do the quality control on these dental units. It only covers intraoral, panoramic, and ceph. There's a task group, which I'll note later on, that is in process of working a document like this for cone beam CTs. Okay, one last thing I want to bring up on specifications or on doing QA, and that is there is a federal guideline for doing HVLs. And as you can see, the highlighted KV points there and the actual HVL that's required. And maybe you're asking the question, well, why is this so important? Well, the big thing is you want to keep the actual skin dose to the patient down. And you do that by having filtration put into the X-ray unit itself. And the way to measure what that filtration is in a, let's say, an indirect way is a half value layer. So these specifications are federal guidelines. If you had a Gendex 770, which shoots 70 kV with 7 MA, and you had a half value layer of 1.3 or 1.2, then that unit would not pass federal guidelines and should be either looked at by a service engineer or taken out of service. Again, there's a link down there if you want to take and go to the 21 CFR. Okay, what are some of the important considerations when performing QA on dental units? A big thing here is you have limited room space. These facilities aren't typically large. And the other thing is QAs often has to be performed during normal business hours. I've been with state inspectors before when we've gone into dental units and you get the patients in there and you're vying for what room you can go into next to do any kind of QA work. And that means that QA work needs to be done rather quickly. So it requires you to be efficient in all that you're doing. A big thing here is having the ability to give printed results, reports, to report how the QA test has gone. And more on that later. And then you need a good X-ray test tool. Obviously, I work for RTI. I'm positive towards our products and lean towards them, but you need an accurate and reproducible test tool. And one last thing, cost of QA is always a concern to the dentist. I'll give you an example. One of the dentists we visited, his panoramic unit had broken down and the service engineer had come in and he needed a specific board. So what did he do? He told the service engineer he was going to go buy the board online and then he'd pay him to come in and put it in for him. So you can see these guys are you know, they're watching their pennies just like all of us do. And this type of stuff goes on. So when they have to pay for QA work, they want to make sure that they're going to get the biggest bang for their dollar. Okay, I'm going to jump into the meters manufactured by RTI. We've got the Cobia Dental, which you can see here, and basically it's got a built-in display. You've got a detector down here, a round detector. It'll measure kV, time, exposure rate, pulses, pulse rate, half valvular, and total filtration. It's a great little meter for doing intraoral work. Then we've got our other Cobia lines, which can be used for dental as well, but they have broader ranges covering the whole realm of diagnostic radiology. And then we've got our Black Piranha, which is our flagship product. It's got built-in Bluetooth. It runs off a tablet. It's got reporting software and everything else. And one of the strengths is you're not only able to do intraoral, but you can also do panoramic. And that's a real important thing because panoramics only have like a 2 millimeter wide beam. So if we look at our solutions in this grid, if you're going to do intraoral, you can do it with the Cobia Dental. You can do it with the Piranha. If you're going to do panoramic, the only product that we've got is our Black Piranha, and that will handle everything that you need to do for dental measurements, whether it's cone beam, CT, or intraoral. And then under cone beam, you can also use a Cobia Dental with no problem because it's got a large field of view. Okay, some of the challenges and solutions in measuring dental x-rays. Here you've got different meters, or I should say different x-ray units that are up there. I've got a panoramic unit, I've got a cone beam CT, I've got an intraoral. So we're going to take and jump into the intraoral measurement challenges. The typical KVs are 60 to 90 and MAs are 6 to 10 approximately. Different waveform types you run into, the single phase half wave rectified, and in addition you get high frequency waveforms out there. A challenge is waveform preheats. Not only did the 770, the Gendex 770 have preheats, but there are other units out there with preheats as well. Then you've got the whole issue of doing the time measurements, and I'll show you that as we go into looking at one of these Gendex 770s and being able to measure the time accurately according to the specification. HVL measurements can be a challenge. More in the less, or more I should say in the sense that making sure they've got enough filtration in the beam. Placement and alignment of the meter, that's pretty simple with intraorals. You need a meter with high sensitivity because you got low output on these units. And then the other thing that's really a benefit is to have a meter that can display the waveform for you. And you'll see that as I go along here. Here's a typical setup in a very tight room with all kinds of instrumentation in it in a dental office. So you go, where do I put my meter? Well, in this case, we've got the black piranha sitting on the chair that the patient would be in to bring the intraoral unit over because there was no room to put it anywhere else. So these are some of the challenges that you run into. Here's the Cobia Dental. This is a nice setup. We had a countertop right there, so it made it very nice for setting up to do the measurement. Okay, what I'm going to run for you now is a little video. I'm going to take in voice over it. I would have liked to have not had to voice over it, but anyway, we'll get past it here with my voiceover. Okay, this is a progeny intraoral unit. Basically, I'm going to take and switch it on there. The power switch is right on the wall mount unit. And I'm going to be taking and moving the arm around to set it up for doing the measurements. And this is going to be using the Cobia Dental. And you're going to see how simple the Cobia Dental is to use for these types of measurements. Basically, I'm lining up the tube. Cobia Dental is already turned on. I'm putting it underneath the tube and looking at it a couple different directions to make sure I've got it centered up appropriately under the X-ray beam. And then we're going to go over here, and on this unit, it's set for 60 kV and 7 MA. Those are fixed. The only thing you can change is the time, and we're set at 125 milliseconds here. So I'm going to take an exposure. And if we had this live, you'd hear a beep from the exposure. But watch the Cobia Dental. There you go, 60.75 kV. You get your dose. You get the time at 125 milliseconds. You get your dose rate. There's your total filtration at 2.1 and your half value layer at 1.9. So half value layer for this unit needed to be 1.5 by federal guidelines. It passed that with no problem. The kV was well within 5%. And so this unit works very nicely for these types of measurements. It's very simple, easy to use. Next up here, I've got measuring with the black piranha. And as you can see, we got a tablet here, and you can see the measurements that are on the tablet with the waveform and so forth. I'm going to move to the next one. This is another little video. I'll walk us through it. Okay, so the first measurement we're going to do here is what we call a position check. This helps us to know we're centered properly under the X-ray beam without doing too much movement around and so forth. And then we're going to start doing some measurements in a template that we have in Ocean. And we've got 5 measurements set up. We start at, obviously the kV is fixed at 60, so there's nothing you're changing there. The MA is set at 7. And what we're doing is we're changing the time measurements here. And we're looking at timer accuracy as well as the kV accuracy. And as you can see there, 50, 100, they're matching up quite nicely. There's your 200 millisecond. And you can see the diff in percent for the kV and for the time. And you can look at your exposure output and how that's going. And then you've got your HVL, which you're able to take a look at that and see how that's responding as well. After those 5 exposures, we actually take 5 more, and these are all for reproducibility. We're looking at the reproducibility of the time, of the kV, and of the exposure. And those all have specifications upon them. And as you can see, we'll just drop down through here and make these shots. And as we get towards the end, you'll be able to see the summary of all the analysis. And an interesting thing here, you're getting the waveform on every one of these exposures. And if you look there on the first 5 exposures, you'll see the kV actually rose a little bit. Well, that's due to the fact that the time went longer and we get more of the kV waveform, and you can see the slope on the kV waveform on the rise there. And that's why you're seeing a little bit higher kV. And I think we're just took the last exposure. And here you go. Here's the summary of the analysis. The kV accuracy passed. I guess we've got one more here. Yeah, the kV accuracy passed, the exposure timer passed, the tube voltage, reproducibility, exposure time reproducibility, and exposure reproducibility all passed. So that gives you a little bit of capabilities of ocean and how you can work with reports and so forth. Now I'm going to run into this old Gendex 770, which you set the time via pulses. And this is typically what you would see from an exposure on a Gendex 770. They have 22 preheat pulses. Okay, the Piranha in this case, with the closeness of the X-ray tube to the detector, showed us 16 of those 22 preheat pulses. And then you get the actual exposure as it's measured. We set this up for 12 pulses. We saw 12 pulses. And the time measured was 186 milliseconds. If we jump to the next one, we just changed the 12 pulses to 16 pulses. Again, look at this waveform. It's important to see this. In this facility of this Gendex 770 that we measured on, the dentist actually called and got a hold of the tech people because he said, I've got another Gendex 770 and I've had to increase the number of pulses to get decent image quality. Can you come in and check it out for me? Again, take a look at this waveform. This is what we saw on that Gendex 770. So basically, we set it up for 12 pulses. We only got 12 pulses. And really, as you can see, they're all rising in terms of the dose rate. The kV is actually coming down. That's due to the preheat and so forth. So, and when we set it for 16 pulses, we got 16. But again, if I go back and look at the typical Gendex 770, you can see there's a problem with this unit. And what the problem was is that the tube head is gone. So it needed to be replaced. So there's a great advantage to having waveform capability to diagnose what's going on with your intraoral dental unit, especially these types of units. And as I said, the Gendex 770s, there's a lot of them out there. In fact, you can buy used ones right now on the street for about $1,000. Okay, we were at another dental facility, and this is an old, very old Belmont unit, intraoral. Doesn't have any preheats. What happened here was the dentist called up the service engineer and said, the state's come and inspected me, and they said that the timer is not functioning, that it's 50% lower than what it should be. So we went in there to take a look at it. Sadly, I don't have the first shot. I wish I did to show you that. But basically, we set it to 12 pulses, and we were only getting 6 pulses. And lo and behold, what the problem was is an earlier service engineer had moved this Belmont unit from one room to the next room, set it up, and one of the things he'd done, he had not put the knob, which you turn to select the pulse number, on properly. And thus, you couldn't set it to what it should be. So it was an easy fix. We took took the set screw, reset it, and then lo and behold, the unit was working beautifully. And so from there, we went to producing a report for the dental office. I'm going to put this up here. This is a PDF of the report itself. You can see the tester here was Frank Schultz. He's got his own company. He's a dental fix guy. And this was the facility in Parsippany, New Jersey. As I scroll down here, there's the name of the unit, tested equipment. This is the kind of report that you get out of Ocean, and which makes it very nice. So here's your summary of all your measurements. You've got your tube voltage accuracy, that passed, pulses accuracy, timer accuracy passed. One thing that's interesting is this is a pulsed unit. You only set the pulses, but the state failed it based upon milliseconds. So in this case, we built a template that gave them both milliseconds and pulses, and obviously both of those passed with no problem. Half valvular passed, and then the reproducibility of the tube voltage, the exposure time, and the exposure reproducibility passed. And here you've got the complete grid of all the measurements with all your set pulses, your reproducibility run of 5. You've got the waveforms that come up on the report, so you can take a look at those. Then you've got all your analysis graphed out for you. So here's your kV accuracy, all within the plus or minus 5%. You've got your pulse rate accuracy, or the number of pulses. Obviously that was dead on. Then you've got your timer accuracy in milliseconds. That's all within the specifications. Get your half value layer. And then you've got all your reproducibility runs showing your coefficient of variation, your mean value, and your maximum deviation, both on tube voltage, your exposure time, and your exposure reproducibility. And then in the comments, Frank wrote, repaired set time issue, the knob needed adjustment. And then what did we do? We actually took and gave that report to the dental office, and then they were in turn sent that off to the state to show that the unit had been repaired. And then Frank got a nice email back from the dental office. You guys are amazing. And I forgot to mention, all requirements passed. This is the beauty of having the ability to make report software that you can take and give your reports to the dental office with all the QA work that you do on the system, especially when you know the state is going to come in at some point to do a survey. Okay, moving on now, panoramic measurement challenges. These are very challenging to measure on. Your typical KVs are 60 to 100, MAs 6 to 10. The KV can be dynamic on some of these throughout the scan. Waveform types you see, single phase and high freq. Rotation times are anywhere typically 6 to 20 seconds depending on the unit. You got to be able to measure an HVL. That's nice where it's got a single shot HVL on the meter that you're using. It's a narrow beam you're working with, basically 2 millimeters wide typically. And then you've got the whole thing of placing and aligning the meter. And the meter needs to have some sensitivity to it as well. And again, the ability to have a waveform is all important. So one of the things you need is some way to take your meter and hold it up there on the panoramic unit. We have a panoramic holder for the Piranha, and basically you've got an adjustable holder base, you've got a position guide with fluorescent screens. I'll show you how those work and how beneficial they are. You've got an adjustable strap with clips and a suction cup, and then you've also got magnets. Some of the older pans had metal housings where they used to put the film in and so forth. The newer ones are mainly all plastic, so it's rare you'll use the magnets, but those magnets are very, very strong. The straps are set up so they got some elasticity to them, so you can tighten it up and so forth. So if you take a look at this, again, we're trying to line up here for a 2 millimeter wide beam. You got gravity working against you because you're trying to hold this thing on the side. You got hardware in the way. You can see the head holder, and there's a mouthpiece that we removed and so forth, because you got to have the area clean as the unit goes around so that it can be it can have the radiation hit it properly and not be covered in any way. You've got different size digital detectors. This is a larger one. I'll show you a smaller one here in a moment. So you get all different sizes, and some of them are tapered the wrong way, so you'd think the thing could just slip off the detector easily. And then the other thing is, how much light do you have? Because when you go to look at these fluorescing screens, you need to have it a little bit dark so you can see where that radiation is. This gives you an idea what the fluorescing screen can do for you. You can see the green on both of these. If I run my mouse here, you can see the green right here and right here on these two fluorescing screens. This is the detector on the Piranha. So that's what we're trying to do. Line this up very close so that the radiation is hitting that 2 millimeter beam. It's definitely a challenge. Here's a little video on actually doing that. Now, the nice thing on this pan unit, before I run the video, is that we could actually lock the pan unit in a service mode and run the radiation. And that way it made it very easy to line up the piranha and make sure we're lined up properly to do the measurement. It's much more difficult if you have to watch it as it goes around, trying to look and see the fluorescing screens. So here we go. You're going to see the screens light up. There they are. They've lit up. The radiation is on. And then you're going to see them go out as the radiation goes off. There you go. So that gives you a little idea how beneficial those fluorescing screens on the panoramic holder can be as you're trying to make measurements on a panoramic unit. Okay, so here's this other panoramic unit that we measured on, and this is another video, and I'll explain what's going on here. Oop, sorry about that. Slides can be a little challenging. Okay, so this is a panoramic PC4000 dental unit. As you can see, we've lined up the panoramic holder with the piranha. Another note here, this is a great benefit of having Bluetooth. There's no cables connected to the piranha. You don't need them. And they can be a real pain if you have to connect cables and with this thing turning around. So a plus for having wireless connectivity. Now basically, what we've got set up here on the screen is a position check. So we can verify, we've looked at the fluorescent screens, but now we're going to verify just with the internal detector and see how accurate our position is. We're looking for a value anywhere from plus or minus 5%. So the ratio should be about 1 if it was perfect. So anywhere from 0.95 to 1.05. And right now I'm pressing the button on the panoramic unit, and it's going to start to turn here. And right now radiation is being produced and it's measuring. And again, this is a position check measurement just to see how well we're lined up. And you're going to get a screenshot here in a second. And you can see we've got a position check of 0.969. So it's about 3% out, which is perfect. The piranha or the ocean software will automatically correct for that 3% off. So we'll get accurate KVs. And now I'm going to go and make another exposure here. You have to reset this unit. It's not automatically reset after each exposure. So before you make the exposure, it resets. Push a few more buttons, step out of the room, and I'm going to start the process. You can see how tight these rooms are. There's not a whole lot of room to get in and out and so forth. So there our exposure is going, and now what's going to happen is the cameraman here is going to come up and he's going to actually show you what's happening. And you can see the KV there, and you can see the half value there, and voila, you've got the waveform. This is a single phase half rectified generator, and there you've got all your values. You get an HVL of 2.6, we're at 78.9, that was 80 kV setting, and a total filtration of 3. Okay, so here's another panoramic unit. This is one has a Ceph unit with it. A lot of pans do that. They put the Ceph with it as well. Cephs are used for taking images of the side of the face. And this is a Gendex, this is a mouthful, Ortholex 9200. Okay, here's a little video of it running, okay? And you can see there's some motion in this one. There's also some other interesting things here that you're going to see in a moment. But as it goes around the back side of the head and everything, this unit does a little bit of a dance and so forth. And then the other thing about this unit is it automatically repositions itself after the exposure. So if I move on from here, another movie for you. This is that same unit, and now we're going to just look at the screen while we take the exposure. It's measuring right now. Watch the tube voltage. See how it climbs, and then it drops back down again. And this is a 12-second exposure on this. And lo and behold, take a look at that waveform. This is what I meant by some of these units actually are dynamic on their KV. Some of these units, as the tube goes around the back side of the head, because they're trying to get the image of the teeth all the way around the mouth, the KVs will increase and decrease. And in addition, your dose rate does that as well. So if we take a look at that up close, here you go. You can see on that center plateau, we're at 70.8 kV. The actual tube voltage that we measured was 65, although that was an average of all the kV across the system. And then you've got your dose rate waveform, and you've got your half value layer and your total filtration. But here you go. This is a high frequency unit, and it actually varies the kV as it does the measurement. Okay, then we've come to the Ceph measurement challenges. Again, the KVs are similar, MAs are similar, waveform types are similar, HVL measurements. Big thing here is sensitivity, because the Ceph unit, the head of the person is all the way out here. And so the tube is being used from the panoramic unit. This actually swings around, and you got a great distance here. So sensitivity is real important to be able to measure on this. So those are the things to take into account. We did not actually do any measurements on the Ceph unit. We didn't have time to do that, so I've got nothing to share here. Next up, we've got our dental cone beam CT units. And what are these units? In one sense, they're kind of glorified panoramic units, apart from the fact they're not narrow beam technology. They've got a large detector, and the tube actually, the beam comes out in a conical shape, and it rotates around the patient, and it gives you images, some would say as good as CT, others would say it's not quite as good as CT, but they're very good images. And they're being used more and more in dental facilities, especially for guys doing periodontic work, dental surgeons and so forth, because they can see things like tumors and all that types of stuff, and see if teeth are impacted and everything. And these units are also used a lot by ENT people. So ear, nose, throat, these have become very popular in many places because it gives almost the capability of having a CT scanner in your facility. And I've got a lot of links here showing where you can get a lot of information if you'd like on cone beam CT. If I move over, there's a whole task group. As I told you before, there's the AAPM task group 175, which covered intraoral and panoramic and Ceph for quality control. There's a task group number 261 that's working on the same thing for cone beam CT systems. In fact, I sat in on the group meeting at the AAPM annual meeting this summer out in Denver, and a lot of different physicists involved, and a lot to cover here, because how do you measure these things? What do you do for the measurements? So here we go, dental cone beam CT. There's a lot of manufacturers. There's a ton of them in Japan. There's definitely manufacturers in the US and in Europe. Your typical KVs are 50 to 120. Typical MAs run from 1 to 20. Waveform types are pulsed and high frequency. Obviously, you've got to do HVL measurements on them. The placement and the alignment of the meter is a whole lot simpler than it is on a panoramic unit, because you have this big broad field on the digital detector, which is right here. So it's very easy to set up your measuring device, Piranha. You could also set up a cobia here, because it's a large field of, that's going to expose the meter. So that's much simpler. I mean, obviously you still get gravity that you have to deal with. You need a meter with decent sensitivity and some other things that come into play. These are some of the things that are being discussed in that task group. How do we measure the doses on these units? They're actually talking about using a CT ion chamber with a CTDI phantom. So that's much more in-depth than most dental x-ray engineers would get involved in, and physicists would get there, but I mean, survey by the state inspectors and so forth, I don't think that would happen, but you never know. Depends on the state agency and the people running it. And again, there's benefits in having the ability to see the waveform when you're doing these measurements. We didn't do any measurements. We couldn't get on a cone beam. Maybe in a future webinar we could do something like that. I don't know. But these are the added items that you'd want to have for doing cone beam. Your CTDI phantom, usually a 16-centimeter head phantom, which is standard for a CT scanner, and then an ion chamber, a CT ion chamber, 10-centimeter long for doing CTDI measurements. The chamber gets put into the phantom, and then you got to stand the phantom up on end on these units and then scan around it and measure the dose there. So this is an added type of measurement that you'd have to do with cone beam CTs. Okay, I'm coming to the end here, and I want to give some acknowledgments. In the picture there is myself with Dr. Dana Wright out of the dental studio in Pendleton. Really want to thank her for letting us come in and use her facility and take some images. I should say take some pictures and do some measurements and so forth. I want to give these other folks acknowledgments as well. That Belmont unit was at Real Dental Care, where Dr. Ninoska Ferguson is, and Frank Schultz is the Dental Fix service guy that went in there with us to do the measurements with his Piranha. And then you've got Dr. Anthony Spain of Spain Orthodontics. He's the one with that Gendex panoramic unit that he changed out the board, had them change out the board and so forth. And he's taken care of by Jonathan Espinoza, who's another Dental Fix service engineer. And then that 770 that had a problem where the tube was bad. That's where Dr. Boris Alvarez is in Bloomfield Dental and Designs in Bloomfield, New Jersey. So I want to give acknowledgement and thank you to all these people that enabled us to get the pictures and the data here to share with all of you on this webinar. So without further ado, I want to give thank you to TechNation allowing us to do this webinar, and all my information's here, and I'm ready to answer questions.
Well, thank you, Rob. We've had a few questions come in throughout your presentation. We want to remind the audience that there is still time. You can use the questions feature on your dashboard. If you have any questions for Rob, go ahead and submit them. If we don't have time to get to them today, then those will be passed along to RTI and they'll follow up with you directly. So let's go ahead and get started. The first question we had come through: what are the basic differences between the RTI cobia and the Piranha meters when using them with dental applications?
The major difference is the cobia has a circular detector, and it's large. It's probably about an inch and a half across, and so it's got many detectors inside of it, where the Piranha has a narrow, thin detector with a few detectors in it. And the big difference here is if you wanted to measure panoramic dental. Panoramic dental requires that narrow beam, that 2 millimeters, so you cannot use a cobia to do that. I hope that answers the question.
Yep, I think so. The next question we had come through: how can I take into account the preheat on some dental units?
Well, the big thing here is the Piranha and the cobia, for that matter, both look at the waveform when they're taking the measurement. A big thing on the preheat is the preheat is not actually part of the exposure time. So you can't take and include the preheat and say that's the time. You'll fail the unit. So And these single-phase half-rectified units need that preheat to get the filament warmed up, and they're actually producing radiation during that time. And so by using either the cobia or the Piranha, it will take into account the preheat automatically. It will give you the dose which includes the preheat, but it'll give you the time measurement and the kV measurement based upon the actual exposure time. So if I went back to one of those slides with the Gendex 770, where we did 12 pulses, it counted 12 pulses, it measured the time appropriately, it gave us the kV, and then it gave us the dose. So any unit that you've got that's got a preheat, and they're not just Gendex 770s out there, there are other units as well. Some older progenies, they had preheats as well. You really don't have to worry about that because the meters take that into account automatically for you.
Okay, thank you for that. The next question we have, can any RTI Piranha do dental QA?
Yes, any RTI Piranha with the specific dental models are the 205 and 255. They have the range set up for dental only. But if you had a 657, and let's say you're an engineer in a hospital or a physicist, and you've got a 657 which covers mammo and CT and everything else, that'll measure dental with no problem as well. It'll work just like the 205 or 255.
Okay. The next question, do I need to purchase the panoramic holder to use the Piranha on a panoramic dental unit?
The answer to that is no, you don't have to do that, but you're going to have a whole lot of fun trying to set it up on the pan unit. If I were going to do it without a panoramic holder, I would probably get myself some stick-on industrial Velcro and put that on the back of the Piranha, and then I'd have to stick it onto the detector of the panoramic unit, and then I'd have to move it around trying to get it positioned. The holder is so much easier in terms of having the fluorescing screens for an initial setup, and then you can do the position check measurement to make sure you're lined up. But no, you don't have to buy it, but it'll save you a lot of time. And I think time is money, and the amount of money for a panoramic holder isn't that expensive. So I would highly recommend, if you've got a Piranha, get yourself a panoramic holder if you're going to do panoramic dental.
Great, and we've got another question, the last question that came through. Do I need the RTI Ocean professional software to perform dental QA with my RTI meter?
Depends on what you're looking at. If you have a Piranha, yes, you'll need at least the lower level version of Ocean that would allow you to do quick check. But if you want to do reports and so forth, then you'd want to have Ocean Professional. That would enable you to put together a report and be able to give that to your customer. You can also, well, the Cobia Dental does not work with Ocean Professional. It's a very simple meter with that. But if you got yourself if all you did was intraoral and you wanted to do report generation, you could get yourself a Cobia Flex, and then you could use the Ocean Professional with that as well.
Great. Well, that wraps up our questions. If any others come through, like I said, we will send those through to RTI and they'll follow up with those directly. In closing today, we want to thank you, Rob, for your great presentation, and we also want to thank today's sponsor, RTI. One lucky attendee will win an Amazon gift card for completing the post-webinar survey, which will appear on your screen shortly. You must complete the survey to obtain your certificate of attendance. If you do not see the survey, please email us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website at onetechnation.com/webinars, and that's the number 1technation.com/webinars. Thanks again, everyone, and we'll see you next week.